Well, the Joint Monitoring Program report by the World Health Organization and UNICEF says half of healthcare facilities around the world lack basic hygiene services. The report reveals that basic water and soap or alcohol-based hand rub are not available where patients receive care and at toilets in these facilities. Around 3.9 billion people use these facilities, putting them at greater risk of infection, including 688 million of them will receive care at facilities with no hygiene services at all. Now, death from non-communicable diseases like cardiovascular disease, mental and neurological disorders, and diabetes are rising in sub-Saharan Africa. They accounted for 37% of the death in 2019, a big jump since 2000, when 24% of deaths were linked to non-communicable diseases, according to the WHO. Health ministers in Africa adopted a strategy to increase access to diagnosis, treatment, and care for these illnesses. Dr. Prebo Barango, a medical officer with the WHO's Regional Office for Africa, shares some insight on the subject.
So the severe NCDs are things like type 1 diabetes, which is insulin dependent, sickle cell disease, rheumatic heart disease, hypertension, and those severe NCDs. Now, usually in most African countries, access to care for these severe NCDs are usually in the urban centers, in tertiary referral centers. People that are in peri-urban or rural areas usually have limited access to care when they have these conditions. So what the strategy is aiming at doing is to capacitate the district level facilities, which is closer to the rural and peri-urban areas, to capacitate them to be able to diagnose, treat, and manage these chronic and severe NCDs. Also, strengthening the referral mechanisms between the district level and the tertiary referral facilities, but primarily to provide the district level facilities with enough, the human resource available there should have adequate training using simple protocols, and then to ensure that not just being trained, but they have the wherewithal to be able to provide this service. So they have the necessary medicines and diagnostic technologies that are available at this level of facility.
Now to Senegal, where to reduce the spread of HIV, a Dakar clinic is offering a free opioid substitution to people who inject drugs. CEPIAD is one of the first harm reduction centers in Senegal. Take a look. This is a special unit at the Fann Hospital in Dakar, commonly known as CEPIAD. The drop-in clinic provides an opioid substitution therapy program to people with drug addiction. CEPIAD aims to lower the spread of HIV among drug users by reducing the risk of engaging in risky behaviors, such as needle sharing and unprotected sex. 250 people are currently receiving treatment.
Methadone is a medicine that acts as a heroin substitute. In our case, it's a syrup dosed in 10 milligram portions. Doses vary from patient to patient.
Country data show the infection rate of HIV in Senegal is about 0.5%. The rate jumps to 9% among people who inject drugs. Most patients are men, but the center is working to enroll more women in the program. UNAIDS says one adolescent girl is infected with HIV every 2 minutes globally.
I go out into the community and visit my peers to raise awareness about getting off drugs and reducing health risks. So I refer them to CEPIAD, and they can, like me, stop using drugs.
In addition to HIV services, CEPIAD has become a screening and diagnostic center for tuberculosis and hepatitis. It also offers psychosocial support and other wellness services.
I am here to take my treatment, and I am a tailor.
Gardening is like a type of therapy. When we are here, we forget our problems.
While drug use is illegal in Senegal, CEPIAD has the support of the government as well as other organizations like the Global Fund and UNAIDS.